Hi, I'm April, and a lot of you know me as the sci-fi Mombie. But I do have a professional life aside from the podcast that I was kind of a share with everyone. But after what's happened in America lately, I just feel like I want to help clear up some things about the revenue cycle, about health insurance. Now, I can't talk about car insurance. I can't talk about life insurance, um, or any other kind of insurance that you might take out. All I can do is give you tips and pointers on health insurance. Um, so this is like a new series for me. Um, please don't attack. I'm actually really trying to help you because I personally know what it's like to not have a benefit for something that you direly need. And I went on the advocacy beginning in 2015 with my employer to get the benefit back for all of us at the company. I was the first to have the gastric sleeve surgery, the weight loss surgery in 2019. I am at my 5-year anniversary on the 19th, and I've kept my weight off. So, look, as much as I want to say it's all rainbows and butterflies and shitting glitter, it doesn't work that way. Nothing is just handed to you, okay? You have to fight for it, but before you fight for it, you need to have the knowledge, and you have to do your research. You can't rely on anybody else to do it for you. I'm sorry. It doesn't work that way. I wish it did, but it doesn't, okay? So so this first episode that I'm gonna do, I'm gonna talk about just some general information, and some questions that I get from time to time from friends and family as I help them with their medical claims issues. So, a little background on myself. I have worked for an insurance company for 12 years. Um, I actually, this is my second career, guys. I actually have I have a degree in film and mass media with a minor in human resources. Um, in 2007, after having my second child, became very ill. Come to find out, I had a tumor in my chest. I had the tumor removed in March of 2007, and I contracted MRSA staph or superbug staph from the hospital after surgery. I became septic. I almost died. Um, if it wasn't for the quick action of my surgeon and his team, I would have. It would have infected my heart valves, and I wouldn't be here today. And I mean, I celebrated my birthday yesterday. I'm recording this on December 15th. Um, I am blessed and grateful that I am still here. And I'm actually doing what I want to do with my life, thanks to my surgeon and all of the doctors that have helped me all these years. Now, first thing, let's talk about you got hired. Okay, well, I'm still trying to tell you about my background. I lost my job in 2007 with the CBS Fox affiliate I was working for in my town. Um, I ran out of FMLA. I had a baby. I had to have the tumor removed. They did not. They wouldn't let me. And then I reapplied. I sat for from I was fully cleared in June 2007, so I finally got employment in August of 2007. For that amount of time, I sat at home. I had another interview with my former company and my former boss, and I was telling him, I'm sitting here watching my children. I'm actively looking for a job, um, and he took that as I'm being lazy, I'm not doing it. So he didn't rehire me. And that's okay because it prompted me to think about a career change. And healthcare is where it's at. It really is. I mean, I know a lot of people are burnt out from COVID, but you're needed in that field if you choose that career. Don't go into that career if you're just looking for a job because our members and our patients don't deserve that. They deserve quality care. And let me tell you, my oldest had chronic ear infections as a child, and we didn't smoke. Um, it's just his anatomy, and unfortunately, I had it too. But back then, because I'm a late '70s baby, all they did was hand you some penicillin and good luck, you know. Um, but we had to run in with the nurse when my son was 4. We manhandled him, tore the piece of skin right here in his mouth, and you just tell that person it wasn't a career for him. And forgiven and moved on, but please, guys, do what you don't just get a job and look at it like, "Oh, yeah, here I am." Do what you love. Do I love medical billing and, um, health insurance claims? A little, I'm a nerd, but I love helping people, and I have to tell you, it really hurt me this week when the manifesto came out and we called us parasites. Those of us who work for the health insurance company, we're not parasites. We actually try to pay all of your claims. I have done like when I was claim processing on the provider side for employer and individual, um, I took liberties because it wasn't right, and I got dinged on my quality, and I lost some bonuses because after I did all my research, I saw that they were. But anyways, I transferred in 2019 to a different department, and I love this department because I can actually do the right thing to help our members, and it makes me feel so much better. I am proud of who I work for, and I'm not a parasite, and I don't ever want anybody to call anybody in the health insurance, field a parasite because a lot of us are doing the best that we can to help our members. So, right. So that's my background. I started at a healthcare facility in August of 2007, and then I found out I was pregnant with my daughter. It's fascinating. I was still sick and healing from the surgery. I don't know why it took me so long to heal. I think it was because I was pregnant. Um, she's 16 now. You all know her. I'm the producer. Um, but I started just entering insurance, health insurance, you know, and I made sure, I was very meticulous. I didn't like the claims rejecting on the front end through EDI. I didn't like it. Electronic electronic exchange system that most insurance companies and providers use. I also inputted Medicaid, Medicare, TRICARE, all those different. Definitely didn't like it when those rejected out. It was stupid. And normally it was a tiny thing. Um, so I- this, and so then I stayed at that job for 7 years, and in 2013, I was hired on by the health insurance company, and I've been here ever since. But before, when I was at the affiliate, I got I kinda did double duty, double hats. I was a sales assistant, and then I was a business office assistant, and if they couldn't get any of their claims paid, my boss would hand me their EOBs, explanation of benefits, and tell me to go research it and see if you can get this paid. Okay. I was successful on several, but because of the way your employer writes your benefits, that's why your claims are denied. It's a small fraction of why your claims are denied. So I went back to school in 2011. My kids were toddlers, and that was frustrating in and of itself because I once upon a time before I got my degree in film wanted to be a radiographer. And so I had anatomy and physiology, organic chemistry. I had all that under my belt and I could not get into radiography school. It's that competitive. You know what kicked me out? A D in psychology. A D in psychology, guys. So I switched and I did what I love. I love the film industry. I don't give a damn about if you say it's stupid. I don't care. It's what I love. And I'm so glad that I get to use my knowledge into my podcasts and my shows and my business. It's everything I love being with you guys. That's what makes it fun. So I went back to school and I graduated with my medical coding certificate. I went through all the classes. I learned ICD-9, ICD-10, CPT-4, DSM-5. I learned the dental portion. Called. Um, it's a lot to remember. And at that time, the the world had already been on ICD-10 for a while. So the United States is always behind in diagnosis coding. We were doing the switchover. That happened in 2015. So I learned all that and I got a lot of pushback from my employer at the time. They did not want me doing that. Too bad I did it anyways. Nobody's going to stop me. So here we are today. And I just am sad and frustrated that I'm seeing a lack of people with the curiosity and what's the word I'm looking for? Initiative to grasp the knowledge of what they need to know. Um, so that's why I'm here. Not only to say knowledge is power, we've all watched Schoolhouse Rock, um, but to protect yourself, you need to grasp the knowledge and the terminology, and you need to check your policy every year when you do open enrollment. You need to check all your sensitive health information on your policy, make sure it's all correct. Your phone numbers, your address, your names, um, dates of birth, um, what plan you chose, do you have a savings account. You have to have all that in line to make sure all your medical claims go through first time. Um, let me give you, a lot of people are using the 37% denial rate for certain health insurance companies. I can't name it because I work for it. Um, it's not just medical reasons that deny. a health insurance company, okay? And I wish I had the stats to tell you, I'm gonna find them, about the difference between clerical denials and medical denial. But let me start off with a very common denial, okay? Coordination of benefits. Do you know what that is? All right. Coordination of benefits is where you have another insurance and you have like two insurances. So let's use an example of you are retirement age and you're still working and you can take out Medicare. This is common across the country. Everybody can do it if you're retired. Um, let me tell you, let me just do a little bit more into my background. My ex husband was disabled for a time because he had a botched back surgery. And he was on SSA and Medicare. And I carried my employer's health insurance on him. We had to fight every damn year. I was about to say the F word to get the insurance company to coordinate the benefits right. So, I'm gonna give you a little tip. Okay? Here's the rule from CMS. If your employer group has over 100 employees, your health insurance is primary, the Medicare is secondary. Then, if you have a Medicare supplement or you have Medicaid, that is always the last resort payer, is what they call it, or third. Um, if your employer is small and has 100 or less employees, Medicare is primary. The rule hasn't changed, still the same. Um, don't believe me? Look it up. CMS.gov. So that is the most common denial of benefit, always. Besides wrong name, guys, use your names to register for your health insurance. Don't use nicknames. So your name is Sandra, but you register as Sandy, picks it out all the time. Even though we can do it's like a 6 degrees of separation match. It will still pick it out. Wrong date of birth. Your employer messed up and entered 1957, but you were born in 1956. That's a common problem for those of you who are having children or adopting. You don't add the child within the time frame that your plan sets. Most of the times it's within 30 days of birth. Pick it out. Or in open enrollment, you forgot to add a dependent. That could, so these are the most common denials. They're clerical denials. They're not medical. And I hear journalists saying, just lumping all denials together. No, you can't do that. Okay. You just can't. You have to separate them. Yeah, there are a lot of dumbass denials for medical reasons, for the medical policies for each health insurance company based on CMS guidelines. Can you hear me? Health insurance companies are mandated to build their medical policies from CMS guidelines. So, more typical denial. Okay, just started at your job and your employer has a 30, 60, 90-day window to where you can't have coverage yet. You have an accident or you are acutely sick and you have to go to the hospital to get care and you bill your insurance. Um, and you're in that window. You're in that window. You're going to get a denial from the insurance company, first of all. And it's going to have a remark code because that's what we have to use because that's the way we code it in our systems to kick out your explanation of benefits. Um, that says no coverage for that date of service or service not covered because of no eligibility. Okay. So that's the second most that you'll see for a clerical denial. Um, there's so many reasons. Like one that is rare, but it does happen. Say you're eligible for Medicare and you still want to carry your health insurance because you have dependents, um, and you make it dependent only coverage. Well, you're not technically covered, only your dependents are. And if your provider bills that insurance, it's going to get denied, clerically denied, because you're technically not covered under the plan. So get to know the first thing I always tell people is get to know benefits that your employer group built for you. Stop putting blame solely on the insurance company. I mean it. It's not we're look, health insurance companies are simply the administrators of the plans. So what does that mean? That means that we process the claim, we help build the benefit packages for employer groups. Yes, we do set the prices based on certain things. And I really want to speak out about the profit margins, but I have to be careful. And I've been on the non-receiving end of bonuses. Let me tell you, I bitched for years about the pay structure at my company, especially for those little people like me at the bottom of the totem pole, because they are the worker ants. We are. We deserve more pay. I mean, God, I don't know how long I've advocated for that. I tell you guys, when I go on a crusade, I do it. And I go in full heart with passion because morality is important. And these things are morally right to pay these claims to take the stress off the patient who is trying to recover from illness. I get tired of seeing denial for radiation. I do. I get tired of providers not being paid the correct scale when their contract wasn't uploaded into the system correctly every year. So another common denial you'll see. I'm switching from clerical. I don't know, maybe this does fall under clerical. Okay, so there's two coding systems primarily that providers use after they document the member's chart to bill the insurance company for the procedures that the member had in the office or in the hospital or in a therapy setting or a chiropractor's office or if you have acupuncture and acupuncturist office. There's so many hearing aids and vision and dental. There's so many places of service that your medical claim can be billed. Um, there are some providers, I don't want to hear it. We're all human. we fudge a number. It happens. Um, but there is a lot of fraud and waste going on and abuse. There is. Um, I know when my ex was on Medicare, we got phone call after phone call sometimes of these dumbass companies wanting to get it from the back. No, no, thank you. No. I tried to do it. We returned them. So, um, it's something that, quite honestly, in the provider's office, every single person that touches a medical claim should have coding under their belt, medical coding under their belt, at least a general knowledge of it. When I was first hired on by the provider's office, um, my supervisor was like, "You're too smart to just be entering insurance." So they put me on claims. I excelled. That's because I like to know it all. And so I found out the knowledge and I researched the codes and I went back to school to get the knowledge to know about all the codes. Um, but I'm going to say most of the denials that you're going to see medically wise and clerical wise, they kind of cross over each other. As a provider trying to build things that can't be built that way. I'll give you an example. Uh, Say you go in for your preventative labs at the beginning of the year. Some providers try to bill lab services that are normally considered bundled. They unbundle them. There's actually a policy out of CMS on this. Okay. Um, so it kicks out a denial for whatever lab you had. It'll happen. Um, and the provider needs to fix their coding. Another one is, say you fell, you had an accident at home. It wasn't auto, it wasn't workers' comp, and you broke your wrist. Um, and they billed for 3 views of your wrist to see the break, and the provider didn't like the way the films were done first, so they brought you back again, and they bill you twice. Well, that's maximum frequency per day. That will kick it up. You should have just ate the second X-ray because it was the X-ray tech's fault. So that's kind of an abuse right there. Um, Say you're in the hospital and you are discharged on the same day, and they immediately usher you in to see the provider on the same day or a wellness check after you were in the hospital. Well, according to CMS guidelines, there are some in-office services that are considered global, meaning you can't be billed for them because you were just in the hospital. They're considered a part of the hospital. So that's just some of the CMS guideline denials that you'll see because the provider isn't billing the codes correctly. It's not all of them, but it's some of them. And it's really frustrating when you For me, I always want to code the best I can. I don't do it a lot now, but um, bill your claim right. I always want to make sure the provider documented the correct time they were with you in the office. That's another abuse. A lot of providers are trying to bill the higher code, which has more time to get more payment, and it's not right. The provider spent 15 minutes with you. That's a 99213. That's a basic office visit. You come in for your preventive exam and you have a cough. Okay. Well, a typical 30-minute preventive exam is like a 99396. And then if you have a problem, you spend an extra 15 minutes on that. That's a 99213 with a 25 modifier. There are modifiers that are attached to the procedure code to say, hey, wait a minute, you know, don't deny this because we actually spent the extra time with the patient because they were sick. So this is above, you know, the preventative care. I mean, pay attention to your explanation of benefits. And I'm going to show you one of those here soon. I got one. I'm going to do a little segment on it. We're going to walk through what a typical explanation of benefits looks like. Um, just open every one of them. Utilize your app. I scrutinize over even the pharmacy claims. Continue on 1 supplements. See, even after having gastric sleeve surgery, you still have to be on medication. At least I got to kick blood pressure meds. That's the fun one for me. I'm so excited about that. But anyways, um, but make sure because most providers now are electronic documenting your chart while you're in there talking and they're looking you over and just getting a general sense of. Make sure that they document the time they spent with you, which most of the time the computer systems, the minute the doctor enters the room, it will watch it. You know what I'm saying? When the doctor starts talking to you. But make sure it's documented right. You at any time as the patient have the right to your medical records. Any time. Anytime. Um, so get a copy. Make sure they put everything in there. If they didn't, remind them. Say, wait, you forgot. You talked about wait, you forgot we talked because every problem that you bring to your visit is actually a code that needs to be put on your claim for your health record. Because if you go to like you're in an accident, you go to the or you're just absolutely really sick and you're not talkative and they need to figure out what's going on with you, like you have severe diabetes, you had an asthma attack, you had a heart attack, stroke. They need to look through your chart and find out, oh wow, they have high blood pressure. Oh wow, they have diabetes. Oh wow, look at this. You know, they're on blood thinners. That's why it's so important to pay attention and gain the knowledge of your health insurance, no matter where it comes from. Um, and if there's a mistake, it's got to be removed. Gotta be removed. Because when the claim hits the insurance company's system, and now the diagnosis code is what is matched against the benefits, not the procedure code. Procedure code is secondary. Um, it makes a huge difference. Um, I always joke, and y'all know this on the Sci-Fi Mommy podcast, you know, how I like to be funny. I try to make it lighthearted. That's what I'm trying to do with this series now. I want you guys to use that lump 3 feet above your ass. Jimmy Dugan told us in A League of Their Own. We were given a beautiful frame by our creator, if you believe in that. Um, and don't stop thinking. Even if you have trouble reading, which dyslexia runs in my family. Not for me, but for family members. I feel so bad for them. ADHD. Look it up. There's a lot of great audiobooks. Even if it's fiction, it makes the brain work, you know? But get to know your provider very well. Very well. Hey doc, what's your track record on XYZ? What are your credentials? The first thing if you schedule for a new physician, the first thing you should always ask, don't say, "Do you take my insurance?" They're gonna tell you, "Uh-huh," and then they're out of network. Don't do that. Say like this, okay? "Are you contracted with my insurance?" You hear me? Okay, I'm gonna repeat it again. "Are you contracted with my insurance?" Don't say, "Do you accept my insurance?" I won't tell you how many times in the provider's office I was instructed to tell them, "Oh, yeah." You know how bad that made me feel? I got in trouble for this actually because I refused to do scripting. Um, I don't like misleading people and they lose money. So first thing, your PCP refers you to a new doctor, a specialist. By the way, there's a whole list of specialty procedure codes. They're like 99244 or something like that. They're like you got to find a new primary care physician. A lot of plans require you to have a primary care physician. And if you have an HMO, you definitely have to have one. And you probably have to have what's called a referral to be seen by other providers in the network. Um, but the first thing you call the office, you get referred, your referral or whatever you need is in order. The first thing you say to the doctor's office when you're scheduling the appointment is, "Are you contracted with my insurance?" Now, there are some obscure plans, and I've seen them with Blue Cross, where you're supposed to be like umbrella covered by their PPO, HMO, POS umbrella network, but they are outside of the network. So you will end up paying out of pocket expenses out of network, and you won't get discounts. You won't get, you know, it might like for me and the kids, we have out of network benefits. However, it's harder to meet your out of pocket on out of network benefits because it's a different level. It's usually a higher level than in network. Because they're trying to get you to go to doctors who have signed a contract with your insurance. So watch for that. Blanket say it right out. Are you contracted with my insurance? Okay. I'm trying to think of, make sure you always provide your state issued ID with your legal name on it, which you know it's got to be legal. Yeah, I just got my license renewed. You will not believe what I had to do to get that done. And an insurance card, an up to date insurance card. even if it's electronic, even if it's tattered, you know what I mean? Have it on you, make them take a copy, because on the back, it instructs the provider where to file your claim. So, and most insurance cards now, if you have pharmacy benefits, it has the box that tells Walgreens or CVS, "Oh, yeah, their benefits are, we can file electronically right here." That's another thing. If we're going to our doctors or healthcare professionals and saying, "Are you contracted with my insurance?" Do the same with your your vision, your dental, so what's another rider, and your pharmacy. Your pharmacy. I'm gonna do a show on that later where I'm gonna talk about drugs and pharmacy. It's kind of a part of the Mombie, Sci-Fi Mombie taboo subject series where I want to talk to you about not only your health insurance and how that helps with your prescription drugs, but how there might be some better alternatives to bring down the cost of your prescriptions. I mean, it never hurts to find a cheaper price, especially on the drugs that you need. All right. So for this first episode, thank you so much for listening. I appreciate you all. You're all amazing. As you can see, I'm trying to help you. I'm not your side. I've been wronged by the insurance company. Let me tell you, last year, co-host Vic fell and broke his leg. You guys have no idea what that kid went through. He was a trooper through it all. I mean, he has 9 screws, 2 plates, and a piece of wire still holding his leg together. He's got a 6-inch scar on the inside of his ankle, and he's got a 12-inch scar on the outside over a tiny freak accident. He just tripped and fell at home. That I watched because that's who I am and who I work for. I watched the billing and I watched how the things were processed. Let me tell you, I'm glad I did because it saved me money and Gorilla Man money in the long run. I'm still paying on it, but it was it was worth it. I mean, he was in the hospital for 5 days, and my insurance company tried to deny his inpatient stay. He had extenuating circumstances. I mean, the kid was over 400 pounds. And then I mean, his doctor is fantastic, and I would refer anyone to her. She is so glad she's a part of my network. But he had other issues going on. He had an ulcer. They could never make the cast in the right spot, so he ended up in a boot. We were always worried about the bones shifting. Um, he went through hours and hours of physical therapy. Um, but yeah, I watched every single bill, even when he was at home and he was doing therapy in the home. I watched those bills. The therapist was amazing. I thank every single person a part of Cox Health System for helping Vic last year. I thank them for helping me 17 years ago with my child. I mean, they knew that, that there's those germs in the hospital, and my immune system was shit after having a baby and then having the surgery. So, but if you have questions, please email me. I'm more than happy to help you. I just can't, I guess the thing, I can't advocate for you because it would jeopardize my job. I have to take care of the kids and the furry kids. And I can give you pointers, but it all starts with you knowing your benefits, which is the next recording, and the medical policies of the insurance. They all work together. I just wanted to use this one to say, hey, when you enroll, check your name. Okay. Here's a checklist, and it's going to be at the bottom. Check your name, check your date of birth, check your address, check the phone number, check your dependents and yourself. Make sure you're all active on the policy. Get an updated insurance card. And when you check into the doctor or you call to schedule your appointment, are you contracted with my health insurance plan? Um, but I just, one last thing, because it just comes from my heart. The golden rule is so important. And there's a lot of vitriol right now. There's a lot of hate and a lot of misunderstanding, a lot of disinformation. Um, we have to remember that the people who work for the insurance company, I'm not talking the leadership, I'm talking the worker ants. They're people just trying to support the family and pay their bills. And a lot of us do care. We do care about you. Don't think otherwise. We do. We care. It makes me mad when I see lame ass dumb denials because the provider didn't bill the claim right. And that kicks out a claim 9 times out of 10 over stupid clerical errors or abuse in coding. So if you have questions for me, you can email me at questions@sci-fi mombie.com. Um, like I said, I can't write the appeal for you. I can't advocate for you. Um, but I don't mind just chatting. Um, it's confusing. I can understand that. When I first started working on insurance claims, I was like, this is a dumb denial. This is a dumb denial. And then I started learning more and more about the healthcare industry, and I was going, oh yeah. So I also want to say a lot of it has to do with your employer group. Or if you're on the exchanges, that's the government. That's the government that set those benefits. You have to advocate for yourself and your coworkers to push your employer group to add the benefit so that you can have that coverage. You need to bring down healthcare costs. I know. I get it. Well, the one denial I see the most, and I think it's absolutely stupid, is they don't cover diabetic testing supplies. What the fuck? Diabetes is a huge problem in the United States and around the world. If you can't test your blood sugar to make sure that you can give yourself the right amount of insulin, that's a problem. I care about you guys. I truly do. And I feel like since I have this platform, I'm gonna I want to help because insurance is hard to understand. So first things first, after you enroll, get your insurance company's patient portal, check your name, date of birth, address, phone number, make sure all your dependents are on your plan, get an updated insurance card, and then ask your provider, "Are you contracted with my health insurance?" Okay? Alright. Well, guys, let me know what you think. Smash that like button, share out the stream. Um, now I know I'm gonna get blowback from this. I get it. I get it. I get pushback. Um, and I know you're frustrated, and I know you're probably having a bad day after you see me rambling on and on about health insurance, and you've had a bad experience in the past. But don't forget, this is your benefit. You're paying for. Know every XYZ about it, right? Don't let them get away with what they do. It's going to take a grassroots effort to revamp the healthcare system in the United States. It's I hear, like, I was talking with my sister last night, Big Red, and even if we go to a one payer system, like um, a lot of the world is on, that's not going to change a lot for the United States because it's going to take time to change all this out. It's not going to happen overnight, and I worry about the mood of the country, how we want instant change. It just doesn't happen. It just You have to keep up the good fight. You have to advocate for yourself. So educate yourself, gain the knowledge, and check everything that you can and ask your provider, are you contracted with my health insurance? All right. Everybody have a great day. And I will be doing some more of these. So stay tuned later, Frankie.